You've seen these claims on your feed. Raw milk is healthier. Vaccines cause more harm than good. Fluoride is poisoning our water. And you've probably thought only uneducated people fall for this stuff. Here's the problem with that assumption. A global survey just proved it completely wrong, and the numbers are uncomfortable. I'm talking about the 2026 Edelman Trust Barometer. 16,000 people, 16 countries, 6 debunked health claims. The results? They challenge everything we thought we knew about misinformation. 70%. That's how many people worldwide believe at least one widely debunked health claim, not fringe conspiracy theorists. Not just the uneducated. 7 in 10 humans on this planet. But here's where it gets really interesting. When researchers split the data by education level, they found almost no difference. College graduates believe these myths at 69%. People without degrees, 70%. 1 percentage point, that's the education gap. A 4-year degree, $40,000 minimum, buys you exactly 1% less belief in health misinformation. So if education doesn't protect us, what does? That's what we're investigating today. Let's start with what Edelman actually tested. They presented survey respondents with 6 specific health claims, all of which have been thoroughly debunked by scientific consensus. Claim 1. The risks of childhood vaccines outweigh the benefits. Between 25 and 32% of respondents agreed. That's roughly 1 in 4 people. Claim 2. Fluoride in drinking water is harmful to human health. Same range. 1/4 to 1/3 of people believe this, despite decades of dental research proving the opposite. Claim 3. Raw, unpasteurized milk is healthier than pasteurized milk. And this is where I need to pause, because this one has real consequences happening right now. In 2025, at least 21 people in Florida became severely ill after drinking raw milk. 6 of them were children. The culprits, E. coli and Campylobacter, both eliminated by pasteurization. Here's a number that should end this debate entirely. Unpasteurized dairy is responsible for about 95% of all milk-related illnesses, an 800-fold greater risk than pasteurized products. Pasteurization was invented in 1864, specifically because raw milk was killing people. Louis Pasteur didn't create this process to remove nutrients. He created it to remove death. Yet here we are, in 2026, with 1/4 of the global population convinced that the natural option is somehow safer, and education isn't fixing this. The Edelman report puts it bluntly, and I'm quoting here, "Doubts about nutrition, vaccination, and public safety recommendations are no longer a fringe view. They stem neither from a single ideology nor lack of education." Think about what that means. We've been operating under the assumption that misinformation is an education problem, that if we just teach people more, they'll believe less nonsense. That assumption is wrong. The data varies dramatically by country. In India, 89% of respondents believe at least one debunked health claim. In South Africa, 88%. These are the highest rates globally. The lowest rates? Japan at around 50%, followed by Canada and the United States between 50 and 61%. Still, that's half the population believing medical misinformation. So, if it's not about education, what's driving this? The researchers point to something they call authority transfer. It's how misinformation hijacks our trust. Here's how it works. A claim appears with official-sounding language, NASA confirmed, or Harvard study shows. The authority of the institution transfers to the claim, even when the institution never said it. Your brain shortcuts the verification process. You see the authority marker, you assume the claim was vetted, and you move on. It happens in milliseconds, too fast for critical thinking to engage. And social media amplifies this. When you see a claim shared by 15 friends, your brain processes that as 15 endorsements, even if none of them verified it either. But here's the uncomfortable part. The pandemic didn't help. Scientists communicated poorly, changed guidance repeatedly, and sometimes got it flat wrong. That eroded trust, legitimately. When health authorities tell you masks don't work, then say they do, then add exceptions and caveats. People don't forget. And they shouldn't. The credibility damage was real. The Edelman report explicitly calls for what they term a science communication reset. The old playbook, facts plus authority equals belief, isn't working anymore. So what does work? The researchers found that transparent uncertainty actually builds trust. When scientists say, "We don't know yet," That's more credible than false confidence. This is counterintuitive. We assume authority figures should project certainty, but the data shows humility actually increases credibility, especially after years of overconfident claims that aged poorly. There's another factor nobody wants to talk about. A lot of health misinformation doesn't come from random Facebook pages. It comes from credentialed people, doctors, researchers, even public health officials. When a licensed physician promotes raw milk or questions vaccine safety, the authority transfer is complete. The white coat validates the claim, even when the claim contradicts consensus. And this is where it gets really messy, because some of those credentialed skeptics were right about some things. The lab leak hypothesis, myocarditis risks in young men, the limitations of cloth masks. When the official narrative gets some things wrong, and it did, people extrapolate. They assume if authorities lied about X, maybe they're lying about Y and Z too. It's not irrational. It's pattern matching. The survey found something fascinating about ideology. Health misinformation belief doesn't map cleanly onto political lines. It's not a left or right issue. It's an everywhere issue. Vaccine skepticism trends conservative. But natural is better beliefs. Organic everything, chemical-free living, raw milk enthusiasm. Those trend progressive. Misinformation isn't partisan. It's human. And that's perhaps the most important finding. We've been treating misinformation as a them problem. The data shows it's an us problem, all of us. So what do we actually do with this information? How do you protect yourself and the people you care about when education alone isn't enough? First, and this sounds obvious but isn't, consider checking the actual source before sharing anything health-related, not the headline, not the tweet, the actual study or official statement. Second, and this one's harder, you might want to be skeptical of claims that feel satisfying. Misinformation often succeeds because it confirms what we already want to believe. Raw milk feels natural. Fluoride sounds like a chemical additive. Vaccine skepticism feels like healthy questioning. The feeling of truth isn't the same as truth. They're different things entirely. Third, consider bookmarking 3 verification sources: the FDA, the CDC, and a fact-checking site like Health Feedback. When you see a viral health claim, check there first. Not because these sources are perfect, they're not, but they're transparent about their methodology. They cite their evidence, they update when they're wrong. That's what credibility actually looks like. Fourth, here's something the research actually supports. Consider who benefits. Raw milk advocates are often selling raw milk. Supplement promoters are selling supplements. Follow the money, it helps. Fifth, and this is the uncomfortable one, you might need to accept that your education doesn't make you immune. Having a degree means you're better at constructing arguments for things you already believe. Studies on motivated reasoning show this consistently. The more educated you are, the better you are at finding evidence that supports your existing views. It's a feature, not a bug, but it can work against you. So what can help? Actively seeking out the strongest argument against your current belief, not a straw man, the actual best case. If you can't steelman the opposing view, you don't understand the issue well enough. The Edelman findings suggest institutional trust needs rebuilding from scratch, but that's a long-term project. In the short term, you're your own best defense against health misinformation. That means doing the work, checking sources, questioning your own assumptions, accepting uncertainty. It's not glamorous, but it's the only thing that actually works. And here's something worth considering. When someone shares misinformation with you, they're usually not trying to deceive you. They genuinely believe it. They're worried. They're trying to help. It's possible to correct misinformation without making someone feel stupid. Lead with curiosity, not condemnation. That's interesting. Where did you hear that? Opens doors. That's wrong. Slams them shut. Because here's the real insight from this research. Misinformation isn't primarily an information problem, it's a trust problem, and trust gets rebuilt one conversation at a time. 70% of people believe at least one debunked health claim. That number isn't going down through lectures or fact checks alone. It goes down when people trust the sources doing the correcting. And right now, that trust is broken. The institutions that are supposed to guide us failed repeatedly. Rebuilding that credibility is a generational project. But it starts somewhere. It starts with scientists admitting uncertainty, with institutions acknowledging past mistakes, with all of us holding ourselves to the same standard we demand of others. If you found this useful, subscribe. We investigate claims like this every week. A like helps others find us. And if you've got a health myth you want us to examine, drop it in the comments. Because here's the bottom line: education doesn't protect you from health misinformation. Being careful does. Checking sources does. Intellectual humility does. 70% of us believe at least one lie about our health. The question isn't whether you're in that 70%. The question is whether you're willing to find out which lie is yours. And if you think you're immune because you're educated, well, that's probably the most dangerous myth of all. I'm your host. This is Internet Mythbusters. And until next time, check your sources.